Hi everyone, Fraser here from the Dr. Ahmad Clinic here in number 20 Harley Street, and today we have an exciting treatment. We're going to be working on some pigmentation of the skin, and to do so I'm going to use a Sponge Spicule Therapy. So in the process of this, what will happen is we will create up to 3 million microchannels in the skin, and I will then infuse a bio-white serum. This contains stem cells, depigmenting agents, and also a lot of ingredients to soothe and calm the skin after this treatment, because it is slightly more intensive than what you would get just at your regular sort of cosmetic salon. We're going towards the more medical side of things here. So I'm just going to start the treatment, and what the patient will feel just now is sort of a scratching sensation. It's not painful. Some people do find it a little bit uncomfortable at first. It's a strange sensation. But generally most people seem to tolerate it just fine. And what's really good about this specific treatment is the products we infuse after can be tailored to each individual's specific needs. So we can treat a whole host of conditions like fine lines and aging, we can treat pigmentation, we can also treat types of acne, and one of the main benefits is we are bringing your skin cycles turnover from 28 days down to 7 days. So with this new technology, what we're able to do is take 6 months of treatment and bring that into 2 months. This treatment is performed at 2-week intervals, which is unlike a lot of other pigmentation treatments, which you usually need to wait about 4 to 6 weeks between each. There's no prep for this treatment. You just have to make sure that you're obviously, wearing sunscreen, adhering to sort of good skincare regime. And I'm just massaging and pressing these in, just to bury them into the skin. They'll remain in here for 72 hours, and after that they will fall out with the natural skin shedding process. I'm just going to keep going with this and apply usually about 3 layers until the bottle is finished, and then we'll catch up with you afterwards so that you can have a look to see what the skin is like post-treatment.
We've now got Luke now, who's had the first part of her treatment, and what Fraser has done is he has meticulously infused in the spicules around the skin, paying particular attention to the areas where the pigmentation is visible on the surface as well. Although we have treated the full face, because it's a scan showing there is diffuse pigmentation. So the next part of the treatment is infusion of medicine to regulate the activity of the melanocytes, which actually produce the pigment, as well as lightening agents which will go down inside and start to absorb the pigment that's been released.
So as you can see, we've got a nice mild erythema or reddening to the skin, and now I'm going to apply this bio-white stem cell serum. We've got a lot of new blood circulation here and 3 million microchannels, so this is the perfect time to infuse this for that 3,000 times higher absorption of product. A lot of people are scared of applying things around the eyes, and what is brilliant about this serum is it's perfectly safe for around the eyes, so we've got no problem applying that nice and close to give a bit of rejuvenation and depigmenting around the eyelids as well. Our patient here is just drinking up all of this serum. I've applied almost 10 milliliters or 10 cc's of product, and it's still absorbing, which is excellent. It's exactly what we want to see. This is all going down into the deep layers of the skin to work on the cellular level to help lift that pigmentation and rejuvenate.
phase of the treatment where we have infused in the products, which as I had mentioned earlier, were to regulate the melanocyte activity and start reversing the disease process. So overall today what we've done is we've broken down the pigmentation at the epidermal and the dermal layers. We have started to regulate the production of pigment by regulation of the melanocytes, and we have initiated reversal of the disease process of pigmentation. This is as complete and safe a protocol as it gets for treating pigmentation. Look forward to seeing the results.
So we've applied the repairing mask post-treatment, which is full of humectants like glycerin, hyaluronic acid, fibronectin, beta-glucan. There's a little bit of peppermint in there just to soothe the skin down and provide a cooling sensation. Really lovely post-treatment touch, which is going to seal in all those ingredients and make sure that our patient is ready to walk out the door feeling confident and a bit more back to normal after treatment.